Hi friends and welcome back to Percetis Pulmonology, and today is part 2 of pulmonary wines, and today's sign is air crescent sign. So what are the different synonyms of air crescent sign? These are double earth sign, moon sign and air cap sign. So let's understand the word air crescent sign. Air is gas, crescent is like a crescentric shadow. So when you see presence of air in the crescentric form within the lung parenchyma, we call it as air crescent sign. Okay, as simple as that. Presence of air in a crescentric form within the parenchyma. And to add one word, within the parenchymal consolidation, we call it as air crescent sign. Okay, that is the meaning of air crescent sign. So it is seen both on X-ray and CT scan. It is more legibly seen in CT scan. Please follow my cursor. This is a parenchymal consolidation, and here at the periphery you can see the air in a crescentric form. We see usually call it as radiolucent shadow in a crescentric form. That is known as air crescent sign. As you can see, the appearance of a moon which is in the form of a crescent. Same thing is seen in parenchyma. Whenever air is seen in crescentric form within the lung parenchyma or within the parenchymal consolidation, we call it as air crescent sign. So what is the exact mechanism? How do you see it? First, there is the presence of a consolidation. Consolidation, as we discussed in the last video, it is a replacement of air within the pulmonary parenchyma by either pus, fluid or blood, is known as consolidation. When there is a consolidation, there will be necrosis. Necrosis is microscopic death of a cell or a tissue. With consolidation, necrosis leading to cavity formation. When cavity is when it is treated appropriately, there is a peripheral resorption of the necrosis, which is replaced by air. Okay, consolidation, necrosis, cavity formation, and there is a peripheral resorption, and which is replaced by air. So what does it mean? It is a good prognostic sign. Presence of air crescent sign within the parenchymal consolidation. It is a presence of a good prognostic sign. Means the patient is improving. So only the necrosis is gradually reabsorbed and it is replaced by air. See here, the radiolucent crescentic shadow is at the periphery. Means the reabsorption begins at the periphery, and the necrotic tissue after getting reabsorbed is replaced by air. That is when we see air crescent sign. So what are the causes? Invasive aspergillosis, tuberculosis. Some cases of tuberculosis, all cases which causes consolidation can form air crescent sign, but these are the commonest causes. Bronchogenic carcinoma, hydrated cyst, blood clot in a tuberculous cavity, pulmonary gangrene leading to infarction, necrosis, and then formation of air crescent sign, then hematoma, and within the lung abscess, if there is an anticipated pus, we see this sign. So these are the various causes for air crescentic sign. So what is the difference? Again, one more topic which you need to discuss is difference between the air crescent and the monod sign. So most of the time it is used interchangeably, but we need to exactly know what is the difference between the air crescent and monod sign. Monod sign is used when there is an air surrounding a fungal ball within a pre-existing pulmonary cavity. Okay, let me explain. Concentrate on this diagrammatic picture. The outer ring is an cavity. Okay, outer ring is an pulmonary cavity, and here and the inside circle is an fungal ball. So when there is an cavity and there is a presence of a fungal ball, and the remaining area which gets filled by air forms an crescent-like shadow, and this is known as monod sign. Okay, cavity, presence of fungal ball within the cavity, and whatever the space is left within the cavity is filled by air, and it take a form of a crescent, that is known as monod sign. So what is the difference? It is it changes its position with when the patient is asked to lie prone. The mass gets shifted upward. The fungal ball gets shifted upward. That means it's mobile, and it is usually seen in immunocompetent patients. Okay, and the most common cause is aspergilloma. Okay, the difference is it is mobile with the change in position of the patient, and it is seen in aspergilloma, and it is usually seen in immunocompetent patient. Okay, that is the difference between the air crescent and monod sign. Okay, this is about today's pulmonary ones part 2, that is air crescent sign. If you have any doubt, please leave it in the comment. Okay, please do share, like and subscribe. Okay, we'll come back to the next week with the next sign. Okay, thank you all for patient listening.